Quiz study guide with practice exams, 127 questions with explained answers. Question 1. What should the medical assistant verify for accuracy at each visit for an established patient? Option A, the patient address and telephone number. Option B, the patient social security number. Option C, the patient clinic number. Option D, the patient marital status. The correct answer is option A, the patient address and telephone number. Explanation. Verifying the address and telephone number at every visit ensures billing statements and notifications reach the patient without delay. Question 2. In accounting, assets are defined as which of the following? Option A, securities. Option B, machinery. Option C, merchandise. Option D, all of the above. The correct answer is option D, all of the above. Explanation. Assets include all tangible and intangible property or items of value owned by an individual or business enterprise. Question 3. Which of the following statements accurately describes cystic fibrosis? Option A, it is a genetic condition diagnosed through testing sweat chloride levels. Option B, it is an acute viral autoimmune disorder. Option C, it is completely cured by short-term antibiotic therapy. Option D, it exclusively affects adult renal functioning. The correct answer is option A, it is a genetic condition diagnosed through testing sweat chloride levels. Explanation. Cystic fibrosis is an inherited autosomal recessive disorder affecting exocrine glands, diagnosed by elevated chloride in the sweat test. Question 4. What is the medical definition of the term diaphoresis? Option A, profuse vomiting. Option B, profuse sweating. Option C, gasping for air. Option D, difficulty swallowing. The correct answer is option B, profuse sweating. Explanation. Diaphoresis refers to excessive, profuse perspiration or sweating. Question 5. When is the physician reimbursed directly for services by the insurance company? Option A, always. Option B, if the patient has signed an assignment of benefits form. Option C, never. Option D, if the patient has signed a written consent for treatment. The correct answer is option B, if the patient has signed an assignment of benefits form. Explanation. An assignment of benefits authorization directs the insurance company to pay the healthcare provider directly. Question 6. What nutritional term describes a food item that has vitamins and minerals added back to replace nutrients lost during processing? Option A, enriched food. Option B, fortified food. Option C, organic food. Option D, refined food. The correct answer is option A, enriched food. Explanation. Enrichment refers specifically to adding back nutrients that were naturally present in the food but lost during commercial processing. Question 7. Following the death of an established patient, how should the medical office address the final billing statement? Option A, addressed to the estate of followed by the name of the deceased patient. Option B, addressed to the nearest living next of kin personal name. Option C, addressed to the municipal probate court judge. Option D, marked return to sender and discarded immediately. The correct answer is option A, addressed to the estate of followed by the name of the deceased patient. Explanation. Final bills for deceased patients are addressed to the estate of the deceased patient at their last known residence. Question 8. Which of the following represents the most formal and traditional complimentary closing in professional business correspondence? Option A, very truly yours. Option B, warm regards. Option C, best wishes. Option D, cheers. The correct answer is option A, very truly yours. Explanation. Very truly yours is considered the most formal traditional closing for official business and legal correspondence. Question 9. Which of the following descriptions accurately defines a green stick fracture? Option A, a partial break in a young, flexible bone where one side bends and the other breaks. Option B, a compound fracture where bone fragments pierce the skin. Option C, a fracture exclusively involving the growth plate near the wrist. Option D, a comminuted shattering of the tibia into multiple fragments. The correct answer is option A, a partial break in a young, flexible bone where one side bends and the other breaks. Explanation. A green stick fracture is an incomplete pediatric fracture where the bone bends and cracks on only one side without breaking all the way through. Question 10. When dependent children are covered under health insurance policies held by both parents, which plan serves as the primary coverage according to standard coordination rules? Option A, the policy belonging to the parent whose birthday occurs earlier in the calendar year. Option B, the policy belonging to the older parent by biological age. Option C, the policy that has been in active effect for the greatest number of years. Option D, the policy that provides the highest monetary deductible. The correct answer is option A, the policy belonging to the parent whose birthday occurs earlier in the calendar year. Explanation. Under the birthday rule, the primary coverage for dependent children is determined by which parent has the earlier birth month and day in the calendar year. Question 11. Which federal insurance program provides coverage for patients of any age diagnosed with end-stage renal disease? Option A, Medicare. Option B, workers' compensation. Option C, TRICARE. Option D, CHAMPA. The correct answer is option A, Medicare. Explanation. Medicare coverage is extended to individuals of any age who experience permanent kidney failure requiring dialysis or transplantation. Question 12. Which of the following procedural steps is required when preparing and depositing financial checks at a banking institution? Option A, completing a standardized banking deposit slip. Option B, listing currency and individual checks separately on the slip. Option C, providing authorized endorsement on the back of each check. Option D, all of the above. The correct answer is option D, all of the above. Explanation. Proper banking deposits require complete itemization of cash and checks, a signed or stamped endorsement, and an accurate deposit ticket. Question 13. What is the primary emergency pharmacological treatment for a patient experiencing severe systemic anaphylaxis? Option A, intramuscular epinephrine injection. Option B, oral acetaminophen tablet. Option C, topical antibiotic ointment. Option D, intravenous insulin infusion. The correct answer is option A, intramuscular epinephrine injection. Explanation. Prompt intramuscular administration of epinephrine in the anterolateral thigh is the first-line life-saving medication for anaphylaxis. Question 14. Which of the following details is standardly specified on a formal physician referral form? Option A, the names of the referring and consulting physicians. Option B, the specific medical problem or diagnosis for referral. Option C, the authorized number of specialty visits. Option D, all of the above. The correct answer is option D, all of the above. Explanation. Referral authorizations contain referring and receiving provider names, diagnosis, reason for consultation, and authorized number of visits. Question 15. Which anatomical reference plane divides the human body into right and left portions? Option A, frontal plane. Option B, sagittal plane. Option C, transverse plane. Option D, coronal plane. The correct answer is option B, sagittal plane. Explanation. A sagittal plane runs vertically from front to back, dividing the body into right and left sections. Question 16. Which of the following tasks is classified as an administrative responsibility of a medical assistant? Option A, maintaining and coordinating the clinic appointment schedule. Option B, performing venous blood collection. Option C, administering subcutaneous medications. Option D, performing diagnostic capillary punctures. The correct answer is option A, maintaining and coordinating the clinic appointment schedule. Explanation. Scheduling patient appointments, billing, and front desk clerical duties are primary administrative functions of medical assisting. Question 17. Which of the following items requires a standardized nutritional food label by federal regulations? Option A, packaged commercial foods. Option B, fresh whole fruits. Option C, fresh unpackaged vegetables. Option D, raw single ingredient meats. The correct answer is option A, packaged commercial foods. Explanation. Federal regulations mandate nutrition facts labels on processed and packaged food products. Question 18. What is the primary clinical purpose of a peak flow meter? Option A, measure how quickly air flows out of the lungs. Option B, diagnose chronic obstructive pulmonary disease. Option C, deliver aerosolized medication to the lungs. Option D, prevent an acute allergic reaction. The correct answer is option A, measure how quickly air flows out of the lungs. Explanation. A peak flow meter measures the maximum rate of airflow expelled during a forced expiration to monitor lung function. Question 19. Which of the following clinical findings is not characteristic of a patient with latent tuberculosis infection? Option A, demonstrates a negative reaction to a tuberculin skin test. Option B, is completely unable to transmit tuberculosis to other people. Option C, demonstrates a normal chest X-ray examination. Option D, exhibits no active symptoms of pulmonary illness. The correct answer is option A, demonstrates a negative reaction to a tuberculin skin test. Explanation. Individuals with latent tuberculosis infection exhibit a positive skin test reaction despite having no active symptoms and normal chest imaging. Question 20. What is the proper first aid intervention for a patient experiencing epistaxis? Option A, pinch the nostrils and tilt the head slightly forward. Option B, tilt the head backward and ingest warm liquids. Option C, administer high-dose aspirin immediately. Option D, place the patient in a prone position with feet elevated. The correct answer is option A, pinch the nostrils and tilt the head slightly forward. Explanation. For epistaxis or nosebleed, tilting the head forward and applying direct pressure to the nasal bridge prevents blood aspiration and swallowing. Question 21. Which of the following clinical items is covered under Medicare Part B medical insurance? Option A, medications administered directly in the medical office. Option B, elective cosmetic surgical procedures. Option C, routine dental cleanings and dentures. Option D, hospital inpatient room and board charges. The correct answer is option A, medications administered directly in the medical office. Explanation. Medicare Part B covers outpatient medical services, clinician fees, and injectable medications administered in a physician office. Question 22. How many electrical leads are recorded on a standard diagnostic electrocardiogram? Option A, 7. Option B, 15. Option C, 5. Option D, 12. The correct answer is option D, 12. Explanation. A standard resting electrocardiogram records 12 leads derived from 10 physical electrodes. Question 23. All of the following macronutrients provide usable kilocalories for the human body except which substance? Option A, insoluble dietary fiber. Option B, dietary fat. Option C, dietary protein. Option D, dietary carbohydrates. The correct answer is option A, insoluble dietary fiber. Explanation. Dietary fiber consists of non-digestible carbohydrates that pass through the digestive tract without contributing significant usable caloric energy. Question 24. Why is it important for the reception staff to promptly greet and acknowledge each patient entering the medical office? Option A, it prevents patients from feeling awkward or ignored. Option B, it ensures the patient signs a promissory note immediately. Option C, it allows the receptionist to perform a physical exam at the desk. Option D, it reduces the physician malpractice liability premiums. The correct answer is option A, it prevents patients from feeling awkward or ignored. Explanation. Prompt acknowledgement welcomes the patient, relieves anxiety, and maintains high standards of customer service. Question 25. When filing medical records in reverse chronological order, where is the most recent document placed? Option A, filed alphabetically by document author. Option B, placed in front of the other documents. Option C, placed in back of the other documents. Option D, filed in a separate auxiliary folder. The correct answer is option B, placed in front of the other documents. Explanation. Reverse chronological ordering places the newest records at the top or front of the file section. Question 26. Which of the following is not a guideline for the proper care of a microscope? Option A, clean the lenses of the microscope with gauze or tissue. Option B, store the microscope with the nose piece rotated to the low-power objective. Option C, clean the enameled surface of the microscope with mild soap and water. Option D, carry the microscope with 2 hands. The correct answer is option A, clean the lenses of the microscope with gauze or tissue. Explanation. Microscope lenses must only be cleaned with specialized lens paper to avoid scratching the optical glass. Question 27. In a problem-oriented record progress note, information directly reported by the patient regarding symptoms and sensations is documented under which section? Option A, subjective. Option B, objective. Option C, assessment. Option D, plan. The correct answer is option A, subjective. Explanation. Subjective data consists of the patient's own descriptions of chief complaints, pain levels, and history. Question 28. What is the medical definition of otodynia? Option A, incision into the eardrum. Option B, surgical procedure that breaks up stones. Option C, pain in the ear. Option D, runny nose and nasal discharge. The correct answer is option C, pain in the ear. Explanation. Otodynia refers specifically to earache or pain in the ear. Question 29. A patient reporting insomnia, agitation, and profound lack of daily motivation following the death of a spouse is demonstrating which stage in the Elizabeth Kubler-Ross grief model? Option A, denial. Option B, anger. Option C, depression. Option D, acceptance. The correct answer is option C, depression. Explanation. Feelings of deep sadness, sleep disturbances, fatigue, and withdrawal are characteristic manifestations of the depression stage of grief. Question 30. Which serious systemic condition can develop as a secondary sequela following an untreated streptococcal pharyngitis infection? Option A, rheumatic fever. Option B, atherosclerosis. Option C, multiple sclerosis. Option D, cystic fibrosis. The correct answer is option A, rheumatic fever. Explanation. Rheumatic fever is an inflammatory sequela resulting from untreated group A beta hemolytic streptococcal infection. Question 31. Which of the following could result in the medical assistant becoming infected with a pathogen? Option A, having an open sore on the hand. Option B, licking a label for a specimen container. Option C, eating while testing a microbiologic specimen. Option D, all of the above. The correct answer is option D, all of the above. Explanation. All listed practices represent major safety violations and exposure risks that allow pathogens to enter the body. Question 32. All of the following are clinical characteristics of a low-range peak flow meter except which statement? Option A, it is designed for use by pediatric patients. Option B, it is standardly used by adult patients with healthy lung capacity. Option C, it can be purchased over the counter without a prescription. Option D, it measures peak expiratory flow ranging from 0 to 300 liters per minute. The correct answer is option B, it is standardly used by adult patients with healthy lung capacity. Explanation. Low-range peak flow meters are calibrated for young children or individuals with severely restricted airflow, whereas standard adult meters range up to 800 liters per minute. Question 33. Which of the following are recognized asthma triggers? Option A, tobacco smoke. Option B, vigorous physical exercise. Option C, animal dander and house dust. Option D, all of the above. The correct answer is option D, all of the above. Explanation. Common asthma triggers include environmental allergens like dust and dander, physical exertion, and airborne irritants like smoke. Question 34. Which of the following needle sizes has the largest lumen? Option A, 25 gauge. Option B, 18 gauge. Option C, 27 gauge. Option D, 20 gauge. The correct answer is option B, 18 gauge. Explanation. Needle gauge is inversely related to lumen size, meaning smaller gauge numbers have wider interior diameters. Question 35. All of the following dietary sources contain significant amounts of cholesterol except which food? Option A, egg whites. Option B, beef liver. Option C, shellfish. Option D, whole milk. The correct answer is option A, egg whites. Explanation. Cholesterol is only found in animal fats and egg yolks. Egg whites consist almost entirely of protein and water with zero cholesterol. Question 36. To achieve the most accurate liquid medication measurement, which clinical guidelines should be followed? Option A, select a measuring syringe closest in capacity to the prescribed dose volume. Option B, read the liquid meniscus at eye level when using a medication cup. Option C, check the medication order and dosage calculation 3 distinct times. Option D, all of the above. The correct answer is option D, all of the above. Explanation. Accurate medication administration demands correct instrument sizing, eye-level meniscus measurement, and rigorous order verification. Question 37. Which of the following clinical manifestations can result from a severe dietary deficiency of vitamin C? Option A, easy bruising and bleeding gums. Option B, impaired wound healing. Option C, muscle fatigue and skin petechiae. Option D, all of the above. The correct answer is option D, all of the above. Explanation. Vitamin C deficiency causes scurvy, characterized by compromised collagen synthesis leading to capillary fragility, bleeding gums, poor wound healing, and bruising. Question 38. When performing adult cardiopulmonary resuscitation, at what target rate should chest compressions be administered? Option A, 115 compressions per minute. Option B, 60 compressions per minute. Option C, 40 compressions per minute. Option D, 200 compressions per minute. The correct answer is option A, 115 compressions per minute. Explanation. Resuscitation guidelines recommend a chest compression rate of 100 to 120 compressions per minute. 115 per minute falls directly in this optimal target window. Question 39. A professional website is an effective communication tool for providing practice information to patients and the general public. Option A, true. Option B, false. The correct answer is option A, true. Explanation. A website gives prospective and existing patients accessible information regarding practice services, office hours, clinician credentials, and patient portal access. Question 40. What is the standard medical meaning of the charting abbreviation follow-up? Option A, follow-up. Option B, fluid intake and output. Option C, fasting blood sugar. Option D, fracture of upper extremity. The correct answer is option A, follow-up. Explanation. The notation indicates a follow-up consultation or examination to assess ongoing treatment response. Question 41. What is the meaning of the medical abbreviation oris utricae? Option A, left eye. Option B, right ear. Option C, both ears. Option D, both eyes. The correct answer is option C, both ears. Explanation. Oris utricae is Latin for both ears. The flashcard notes left and right variations, and oris utricae translates to both ears. Question 42. Where can a healthcare facility obtain authoritative official claim guidelines and legal forms for Medicare billing? Option A, from a designated Medicare administrative contractor fiscal intermediary. Option B, the Internal Revenue Service local field office. Option C, the local municipal county courthouse. Option D, the State Department of Motor Vehicles. The correct answer is option A, from a designated Medicare administrative contractor fiscal intermediary. Explanation. Official Medicare forms and procedural instructions are distributed by authorized Medicare administrative contractors and regional fiscal intermediaries. Question 43. Which part of a prescription form contains the names and quantities of ingredients to be included in the medication? Option A, inscription. Option B, superscription. Option C, subscription. Option D, signa. The correct answer is option A, inscription. Explanation. The inscription specifies the name of the drug, dosage strength, and form, while superscription contains the Rx symbol. Question 44. If a patient is scheduled for hospital admission, admitting orders must be communicated from the attending physician office before the patient arrives. Option A, true. Option B, false. The correct answer is option A, true. Explanation. Hospital admitting protocols require attending orders to be transmitted in advance to establish admitting diagnoses, bed placement, and immediate care orders. Question 45. Which of the following vital signs can be expected in a child that is afebrile? Option A, rectal temperature of 100.9 degrees Fahrenheit. Option B, oral temperature of 38 degrees Celsius. Option C, axillary temperature of 98.6 degrees Fahrenheit. Option D, tympanic temperature of 102 degrees Fahrenheit. The correct answer is option C, axillary temperature of 98.6 degrees Fahrenheit. Explanation. An afebrile child has a normal body temperature without fever, and an axillary temperature of 98.6 degrees Fahrenheit falls within normal limits. Question 46. If an insured patient is required to pay a fixed dollar amount at the time each medical service is rendered, that payment is known as a copayment. Option A, true. Option B, false. The correct answer is option A, true. Explanation. A copayment is a predetermined, fixed out-of-pocket fee paid by the insured patient for a specific covered healthcare service. Question 47. The section of the current procedural terminology manual containing the greatest number of individual codes is the evaluation and management section. Option A, true. Option B, false. The correct answer is option B, false. Explanation. The surgery section contains the largest volume and broadest variety of procedure codes in the current procedural terminology manual. Question 48. The cardiac mitral valve is anatomically synonymous with which medical term? Option A, tricuspid valve. Option B, bicuspid valve. Option C, aortic semilunar valve. Option D, pulmonic valve. The correct answer is option B, bicuspid valve. Explanation. The mitral valve, located between the left atrium and left ventricle, has two cusps and is also known as the bicuspid valve. Question 49. The acronym FACE, arm, speech, time is utilized to help first responders rapidly identify which neurological emergency. Option A, acute cerebrovascular accident or stroke. Option B, onset of active labor and pregnancy. Option C, acute myocardial infarction. Option D, severe migraine headache. The correct answer is option A, acute cerebrovascular accident or stroke. Explanation. FACE, arm, speech, time is an assessment tool used to rapidly detect signs of stroke, facial droop, arm weakness, and speech difficulty. Question 50. Which of the following physical measurements is classified as an anthropometric measurement? Option A, body weight. Option B, blood pressure. Option C, body temperature. Option D, radial pulse rate. The correct answer is option A, body weight. Explanation. Anthropometric measurements assess the size and proportions of the human body, including height, weight, head circumference, and body mass index. Question 51. When an electrocardiogram is performed during a routine clinical examination, how is the procedure billed? Option A, only if the physician interprets the recording during the visit. Option B, as a separate procedure code in addition to the evaluation code. Option C, as an entirely separate encounter visit. Option D, bundled automatically inside the basic office visit code. The correct answer is option B, as a separate procedure code in addition to the evaluation code. Explanation. Diagnostic electrocardiograms are reported using separate current procedural terminology procedure codes alongside the appropriate evaluation and management code. Question 52. What essential billing knowledge must a medical assistant possess regarding health insurance plans accepted by the clinic? Option A, the specific medical services and procedures covered under each plan. Option B, the internal investment portfolio of each insurer. Option C, the personal financial net worth of the insurance executives. Option D, the exact salary of the billing claims processors. The correct answer is option A, the specific medical services and procedures covered under each plan. Explanation. Staff must understand plan-specific coverage rules, pre-authorization criteria, copay structures, and exclusions to prevent billing denials. Question 53. In a business letter, all typographical components of the document should be created using the same typeface font. Option A, true. Option B, false. The correct answer is option A, true. Explanation. Standard professional typography guidelines require consistent font style throughout a business letter to maintain readability and elegance. Question 54. When performing an ear irrigation procedure to remove impacted cerumen, which of the following is an unsafe action that must be avoided? Option A, ensuring that the syringe tip completely seals the external auditory canal. Option B, expelling air bubbles from the irrigation syringe prior to instillation. Option C, tilting the patient head gently toward the affected ear. Option D, directing the stream of irrigation solution toward the roof of the ear canal. The correct answer is option A, ensuring that the syringe tip completely seals the external auditory canal. Explanation. Sealing the ear canal completely creates dangerous hydraulic pressure against the tympanic membrane, increasing the risk of perforation. Question 55. Which administrative activity should the medical assistant perform immediately before morning patients begin arriving? Option A, print the daily appointment schedule for each practicing provider. Option B, conduct the annual financial ledger audit. Option C, send 30-day collection letters to overdue accounts. Option D, submit quarterly tax withholdings to the government. The correct answer is option A, print the daily appointment schedule for each practicing provider. Explanation. Printing daily provider schedules and preparing charts prior to clinic opening ensures seamless patient flow and preparation. Question 56. Who is responsible for providing the patient with written preoperative preparation instructions prior to surgery? Option A, the surgeon office. Option B, the hospital admissions department. Option C, the insurance preauthorization office. Option D, the primary care physician office. The correct answer is option A, the surgeon office. Explanation. The surgeon office is directly responsible for ensuring surgical patients receive and understand detailed preoperative instructions. Question 57. What mode of transmission occurs when pathogens are expelled into the air on a fine spray of moisture droplets? Option A, direct inoculation. Option B, host susceptibility. Option C, indirect vehicle transfer. Option D, droplet infection. The correct answer is option D, droplet infection. Explanation. Droplet infection occurs when infectious respiratory particles are aerosolized by coughing, sneezing, or talking. Question 58. Which of the following metric measurements represents a unit of volume? Option A, liter. Option B, gram. Option C, meter. Option D, Celsius. The correct answer is option A, liter. Explanation. The liter is the basic metric unit of liquid volume and capacity. Question 59. How does a medical classification system become a coding system? Option A, names and descriptions are replaced by numbers and letters. Option B, names are arranged in strictly alphabetic order. Option C, names are shortened to informal abbreviations. Option D, letters in the names of items are rearranged phonetically. The correct answer is option A, names and descriptions are replaced by numbers and letters. Explanation. Coding systems translate descriptive clinical terminology and diagnoses into standardized alphanumeric designations. Question 60. Initiating a debt recovery claim against a delinquent patient in small claims court is generally less costly than filing in a regular civil trial court. Option A, true. Option B, false. The correct answer is option A, true. Explanation. Small claims court features simplified procedures, lower filing fees, and expedited hearings without costly formal legal discovery. Question 61. What are the three fundamental components required to complete a basic communication cycle? Option A, sender, message, and receiver. Option B, sender, interpreter, and barrier. Option C, speaker, listener, and transcript. Option D, questioner, responder, and evaluator. The correct answer is option A, sender, message, and receiver. Explanation. The foundational communication model requires a sender who encodes information, the message itself, and a receiver who decodes it. Question 62. What is the maximum volume in milliliters that can be administered safely via an intramuscular injection into the gluteal muscles of a well-developed adult? Option A, 3 milliliters. Option B, 1 milliliter. Option C, 5 milliliters. Option D, 2 milliliters. The correct answer is option A, 3 milliliters. Explanation. The maximum recommended intramuscular injection volume for large muscle groups such as the gluteus medius or vastus lateralis in adults is 3 milliliters. Question 63. Which psychological theorist proposed the hierarchy of needs? Option A, Abraham Maslow. Option B, Sigmund Freud. Option C, Erik Erikson. Option D, Boris Frederick Skinner. The correct answer is option A, Abraham Maslow. Explanation. Abraham Maslow developed the hierarchy of needs model describing human motivation from basic physiological needs to self-actualization. Question 64. How often should a medical practice obtain updated diagnostic and procedural code books or coding software updates? Option A, annually. Option B, every 6 months. Option C, every 5 years. Option D, only when audited by insurance payers. The correct answer is option A, annually. Explanation. Procedural and diagnostic coding sets are updated annually on October 1st and January 1st, requiring yearly office updates. Question 65. Which patient examination position involves lying on the back with knees bent and feet elevated and separated in stirrups? Option A, Trendelenburg position. Option B, Fowler position. Option C, Sims position. Option D, lithotomy position. The correct answer is option D, lithotomy position. Explanation. The lithotomy position is commonly used for pelvic examinations, where the patient lies supine with knees flexed and feet supported in stirrups. Question 66. What clinical term is used to document a preliminary diagnostic assessment before confirmatory test results are available? Option A, medical impressions. Option B, definitive prognosis. Option C, pathological confirmation. Option D, discharge adjudication. The correct answer is option A, medical impressions. Explanation. A preliminary assessment or diagnostic hypothesis before comprehensive testing is documented as clinical or medical impressions. Question 67. The medical assistant must manually look up procedural codes in the coding manual for every routine office encounter before entering electronic charges. Option A, true. Option B, false. The correct answer is option B, false. Explanation. Routine visit and procedure codes are standardly embedded within electronic health records and practice management software encounter forms, eliminating the need for manual lookup each time. Question 68. What clinical action is indicated when a patient demonstrates a positive induration reaction to a manta-tuberculin skin test? Option A, further diagnostic procedures such as a chest X-ray are performed. Option B, the patient is immediately admitted to strict isolation. Option C, the tuberculin test is repeated on the opposite arm the following day. Option D, no further medical evaluation is necessary. The correct answer is option A, further diagnostic procedures such as a chest X-ray are performed. Explanation. A positive tuberculin skin test requires further evaluation, including a chest radiograph and sputum testing, to rule out active tuberculosis disease. Question 69. In nutritional science, what constitutes a complete protein? Option A, a dietary protein containing all 9 essential amino acids required by the body. Option B, a plant protein containing exclusively non-essential amino acids. Option C, a dietary lipid combined with fat-soluble vitamins. Option D, a complex carbohydrate paired with dietary fiber. The correct answer is option A, a dietary protein containing all 9 essential amino acids required by the body. Explanation. Complete proteins contain adequate proportions of all 9 essential amino acids that the body cannot synthesize endogenously. Question 70. Why is a medical practice not legally required to notify parents when an emancipated minor requests reproductive health information and testing? Option A, emancipated minors have established full legal independence from parents or legal guardians. Option B, minor medical records are automatically placed in public domains. Option C, Parents are legally exempt from healthcare knowledge after a child reaches age 12. Option D. All outpatient diagnostic screenings are exempt from privacy statutes. The correct answer is option A. Emancipated minors have established full legal independence from parents or legal guardians. Explanation. Emancipated minors hold full legal autonomy over their medical decisions, and healthcare providers cannot disclose their records to parents without consent. Question 71. At what point in a comprehensive patient encounter is the detailed health history obtained? Option A. After the physician concludes the complete physical examination. Option B. Before the physician performs the physical examination. Option C. Following the discharge of the patient from the facility. Option D. During the post-treatment billing counseling session. The correct answer is option B. Before the physician performs the physical examination. Explanation. The medical history is taken first so the clinician has critical context to guide the physical examination and diagnostic focus. Question 72. What physiological metabolic state occurs when the body expends more energy than the calories consumed in the diet? Option A. Calorie surplus. Option B. Calorie deficit. Option C. Fluid overload. Option D. Electrolyte imbalance. The correct answer is option B. Calorie deficit. Explanation. A calorie deficit occurs when daily metabolic expenditure exceeds total caloric intake, resulting in weight loss. Question 73. When composing a formal collection letter to a patient with an overdue balance, what element must be explicitly stated? Option A. A specific, firm deadline date by which payment is required. Option B. A threat to publicize the debtor name online. Option C. A list of all other clinic patients with delinquent balances. Option D. A demand for personal collateral property. The correct answer is option A. A specific, firm deadline date by which payment is required. Explanation. A formal collection letter must clearly communicate the outstanding amount and a precise calendar date by which settlement is expected. Question 74. During allergy testing, within what timeframe does the maximal wheal and flare reaction to a skin prick test typically appear? Option A. Between 15 and 20 minutes. Option B. Within 1 to 2 minutes. Option C. Between 24 and 48 hours. Option D. Between 48 and 72 hours. The correct answer is option A. Between 15 and 20 minutes. Explanation. Immediate IgE-mediated skin prick test reactions reach their peak wheal and erythema diameter within 15 to 20 minutes. Question 75. Which appointment scheduling system books 3 or 4 patients every half hour, who are then seen in the order of their arrival? Option A. Wave scheduling. Option B. Stream scheduling. Option C. Clustering scheduling. Option D. Modified wave scheduling. The correct answer is option A. Wave scheduling. Explanation. Wave scheduling schedules several patients at the start of each hour or half-hour block and sees them in arrival order. Question 76. A detailed chronological expansion and narrative account of the patient chief complaint is recorded under which medical record heading? Option A. Present illness. Option B. Family medical history. Option C. Review of systems. Option D. Social history. The correct answer is option A. Present illness. Explanation. The history of present illness provides an in-depth chronological elaboration of the chief complaint, detailing onset, severity, and modifying factors. Question 77. All of the following represent innate or natural defense mechanisms of the human body except which item? Option A. Prescribed synthetic antibiotic medications. Option B. Circulating humoral antibodies. Option C. Phagocytosis by active white blood cells. Option D. Intact cutaneous skin barrier. The correct answer is option A. Prescribed synthetic antibiotic medications. Explanation. Antibiotics are externally administered pharmaceutical compounds, whereas skin, phagocytes, and antibodies are endogenous biological defenses. Question 78. In an international classification of diseases coding manual code such as M84.50XA, what is the clinical function of the character X? Option A. It indicates whether the encounter is initial or subsequent. Option B. It determines the total number of anatomical sites involved. Option C. It indicates whether the condition affects the right or left side. Option D. It serves as a placeholder character for expansion. The correct answer is option D. It serves as a placeholder character for expansion. Explanation. The letter X is used as a placeholder in 10th revision diagnostic codes to allow for future expansion while preserving code structure. Question 79. In a source-oriented medical record, under which chart tab or divider is a radiology report filed? Option A. Hospital records. Option B, progress notes. Option C, laboratory and X-ray. Option D, history and physical. The correct answer is option C, laboratory and X-ray. Explanation. Source-oriented records organize documents according to their origin, placing diagnostic imaging under the laboratory and X-ray section. Question 80. What is the correct translation of the prescription order? Increase dosage to 3 mg 4 times a day. Option A, increase dosage to 3 mg and discontinue in 1 day. Option B, increase dosage to 4 mg 3 times a day. Option C, increase dosage to 3 mg 4 times a day. Option D, increase dosage to 3 mg every other day. The correct answer is option C, increase dosage to 3 mg 4 times a day. Explanation. The Latin term quater and die translates to 4 times a day. Question 81. When should a comma be used to separate elements in a series? Option A, if it is necessary for the understanding of the sentence. Option B, if there are 4, 5, or more elements. Option C, if there are 2 or more elements. Option D, if there are 3 or more elements. The correct answer is option D, if there are 3 or more elements. Explanation. In standard punctuation rules, commas are used to separate 3 or more elements in a series. Question 82. Which of the following is not included in the medical history section of past illnesses and injuries? Option A, accidents and injuries. Option B, occupation. Option C, immunizations. Option D, operations. The correct answer is option B, occupation. Explanation. Occupation is recorded under the social history rather than the past medical history section. Question 83. What is the maximum volume of medication that should standardly be administered in a single subcutaneous injection? Option A, 1 milliliter. Option B, 3 milliliters. Option C, 5 milliliters. Option D, 10 milliliters. The correct answer is option A, 1 milliliter. Explanation. Subcutaneous tissue can comfortably accommodate up to 1 milliliter of fluid without causing painful tissue distension. Question 84. Which of the following legal disputes is most likely to be adjudicated in a small claims court? Option A, failure to pay 2 months of residential rent before vacating an apartment. Option B, a felony armed robbery prosecution. Option C, a major class action pharmaceutical liability lawsuit. Option D, a contested international corporate trademark claim. The correct answer is option A, failure to pay 2 months of residential rent before vacating an apartment. Explanation. Small claims courts resolve minor civil disputes and recovery of unpaid debts under specific statutory monetary thresholds. Question 85. Which of the following is true regarding the current procedural terminology coding manual? Option A, it provides a 5-digit code for procedures and services performed on a patient. Option B, it provides numeric codes that allow for easier communication with insurance providers. Option C, it is divided into 6 main sections. Option D, all of the above. The correct answer is option D, all of the above. Explanation. The current procedural terminology manual uses 5-digit codes divided into 6 sections to standardize procedure reporting for insurance claims. Question 86. Which traditional elements of a formal business letter are omitted when using the simplified letter style? Option A, date line and sender address. Option B, salutation and complimentary closing. Option C, subject line and body paragraphs. Option D, typist reference initials and enclosures. The correct answer is option B, salutation and complimentary closing. Explanation. The simplified letter format omits the formal salutation and complimentary closing, replacing the salutation with a capitalized subject heading. Question 87. Which federal statute establishes consumer protections against harassment, deceptive practices, and abuse by debt collection agencies? Option A, Fair Debt Collection Practices Act. Option B, Health Insurance Portability and Accountability Act. Option C, Americans with Disabilities Act. Option D, Controlled Substances Act. The correct answer is option A, Fair Debt Collection Practices Act. Explanation. The Fair Debt Collection Practices Act restricts abusive, deceptive, and unfair debt collection behaviors by third-party collectors. Question 88. Which of the following food choices is considered an empty-calorie food item? Option A, candy and cake. Option B, commercial cookies. Option C, carbonated soft drinks. Option D, all of the above. The correct answer is option D, all of the above. Explanation. Empty-calorie foods provide substantial caloric energy from sugars and solid fats while offering minimal micronutrient value. Question 89. Which of the following actions best helps a medical assistant project a professional clinical appearance? Option A, wearing small earrings that do not dangle. Option B, wearing stylish shoes with 2-inch high heels. Option C, wearing artificial acrylic nails with bright polish. Option D, wearing excessive decorative jewelry. The correct answer is option A, wearing small earrings that do not dangle. Explanation: small non-dangling earrings comply with professional clinic safety and hygiene standards by minimizing snagging hazards. Question 90. Assuming that an elderly patient will have a difficult time understanding the directions for how to take medication is an example of what concept? Option A, prejudice. Option B, stereotyping. Option C, encoding. Option D, rationalization. The correct answer is option B, stereotyping. Explanation: stereotyping is holding a generalized, oversimplified belief about an entire group of individuals regardless of individual characteristics. Question 91. After printing formal clinic correspondence, a medical assistant identifies an orthographic spelling error. What is the appropriate protocol? Option A, apply correction fluid over the error and handwrite the fix. Option B, correct the digital computer document and reprint the entire letter. Option C, draw a single line across the word and initial beside it. Option D, mail the letter with the minor typographical error unaltered. The correct answer is option B, correct the digital computer document and reprint the entire letter. Explanation: professional business correspondence must be pristine, any error should be rectified in the word processor and reprinted. Question 92. When a medical assistant serves as an official witness to a patient's signature on a consent document, what does this legally signify? Option A, the assistant verified the patient identity and observed the physical signing. Option B, the assistant guarantees the medical outcome of the upcoming procedure. Option C, the assistant personally conducted the surgical risk consultation. Option D, the assistant assumes financial liability for the patient account. The correct answer is option A, the assistant verified the patient identity and observed the physical signing. Explanation: witnessing a signature certifies that the medical assistant confirmed the identity of the signer and saw them sign voluntarily. Question 93. Which of the following components must be included when obtaining informed consent? Option A, an explanation of risks involved with the procedure. Option B, any alternative treatments or procedures available. Option C, the purpose and prognosis of the recommended procedure. Option D, all of the above. The correct answer is option D, all of the above. Explanation: informed consent requires informing the patient of risks, benefits, alternatives, and anticipated outcomes before treatment. Question 94. All of the following are proper patient instructions prior to a standard resting electrocardiogram except which directive? Option A, do not apply body lotion, cream, or body oil on the test day. Option B, avoid wearing full-length tights or pantyhose. Option C, wear comfortable, easily removable loose clothing. Option D, do not consume food or fluids except water for 12 hours before the test. The correct answer is option D, do not consume food or fluids except water for 12 hours before the test. Explanation: fasting is not required for a routine electrocardiogram, although lotions must be avoided to ensure electrode adherence. Question 95. How do third-party insurance payers utilize diagnostic codes submitted on medical claims? Option A, to determine whether the clinical services rendered correspond directly to the patient illness. Option B, to determine the personal credit score of the insured individual. Option C, to schedule future routine appointments for the patient. Option D, to recalculate annual physician malpractice insurance premiums. The correct answer is option A, to determine whether the clinical services rendered correspond directly to the patient illness. Explanation: insurers analyze diagnostic codes to establish medical necessity, verifying that the treatments provided were clinically appropriate for the documented condition. Question 96. What constitutes the past medical history of a patient? Option A, the symptom causing the patient the most immediate trouble. Option B, the hereditary diseases and health of blood relatives. Option C, the patient previous diseases, injuries, and operations. Option D, information about the patient lifestyle and daily habits. The correct answer is option C, the patient previous diseases, injuries, and operations. Explanation: past medical history documents previous illnesses, surgical operations, hospitalizations, major injuries, and treatments. Question 97. What is the medical combining form denoting fungus or fungal infection? Option A, myco. Option B, osteo. Option C, rhino. Option D, angio. The correct answer is option A, myco. Explanation: The prefix in combining form myco is derived from Greek and signifies fungus or fungal organisms. Question 98. What is the medical term for the surgical excision and removal of the gallbladder? Option A, cholecystectomy. Option B, cholelithiasis. Option C, colectomy. Option D, cystrophy. The correct answer is option A, cholecystectomy. Explanation. Cholecystectomy refers to the surgical removal of the gallbladder, whereas cholelithiasis refers to gallstones. Question 99. Even if a patient account is being paid by capitation, a billing record is usually kept for that patient. Option A, true. Option B, false. The correct answer is option A, true. Explanation. Medical practices maintain billing records for capitated patients to track utilization, services rendered, and administrative audits. Question 100. In what directional manner should a compressive roller bandage be applied to an extremity? Option A, proximal to distal. Option B, distal to proximal. Option C, superior to cranial. Option D, medial to lateral only. The correct answer is option B, distal to proximal. Explanation. Bandages on extremities are applied from distal to proximal to facilitate venous return and prevent distal vascular pooling and edema. Question 101. What type of computer software program does the medical assistant usually use to prepare letters? Option A, database management software. Option B, spreadsheet software. Option C, presentation software. Option D, word processing software. The correct answer is option D, word processing software. Explanation. Word processing programs are standard applications for composing, editing, and formatting professional medical correspondence. Question 102. Which of the following statements represents a health characteristic of soluble dietary fiber? Option A, it prolongs the sensation of fullness and satiety. Option B, it is abundant in oats, apples, broccoli, and legumes. Option C, it binds to bile acids and helps lower blood cholesterol. Option D, all of the above. The correct answer is option D, all of the above. Explanation. Soluble fiber slows digestion, aids in cholesterol reduction, enhances satiety, and is found in oats and legumes. Question 103. Medical malpractice resulting from a healthcare professional complete failure to act when a duty exists is classified as what legal form? Option A, misfeasance. Option B, malfeasance. Option C, infeasance. Option D, nonfeasance. The correct answer is option D, nonfeasance. Explanation. Nonfeasance is the failure to perform an essential legal duty or act where obligation to provide care exists. Question 104. On a 12-lead electrocardiogram, leads 1, 2, and 3 are classified under which category? Option A, bipolar limb leads. Option B, augmented unipolar leads. Option C, precordial chest leads. Option D, esophageal leads. The correct answer is option A, bipolar limb leads. Explanation. Standard leads 1, 2, and 3 are bipolar limb leads because they measure the electrical potential difference between two specific electrodes. Question 105. Which technique helps reduce discomfort and tissue trauma during an intramuscular injection? Option A, allowing the antiseptic skin prep to dry completely prior to insertion. Option B, withdrawing the needle at the same angle used for puncture. Option C, holding the needle steady and inserting smoothly and quickly. Option D, all of the above. The correct answer is option D, all of the above. Explanation. Allowing alcohol to dry, quick insertion, stabilizing the needle, and smooth withdrawal all minimize patient pain and tissue irritation. Question 106. In the Index of the International Classification of Diseases Coding Manual, what does a code ending in a dash signify? Option A, additional characters are required to complete the code. Option B, the code is completely deprecated and invalid. Option C, the code must only be used as a primary diagnosis. Option D, the code does not require any clinical documentation. The correct answer is option A, additional characters are required to complete the code. Explanation. A dash at the end of an index entry alerts the coder that additional digits are needed in the tabular list to specify etiology, anatomical site, or encounter. Question 107. Why is it important for a medical assistant to be aware of guidelines for medical necessity? Option A, to link procedure codes to correct diagnosis codes. Option B, to determine what diagnostic tests should be ordered for patients. Option C, to use a variety of codes instead of overusing certain codes. Option D, to be sure that codes reflect a high enough level of service. The correct answer is option A, to link procedure codes to correct diagnosis codes. Explanation. Demonstrating medical necessity requires properly linking diagnosis codes to procedure codes to substantiate why a service was performed. Question 108. After what period of non-payment does a delinquent patient account typically require intensive collection agency activity? Option A, 120 days. Option B, 15 days. Option C, 30 days. Option D, 45 days. The correct answer is option A, 120 days. Explanation. Past due accounts exceeding 120 days with unfulfilled billing notices are standardly referred for aggressive collection agency or legal intervention. Question 109. Which of the following is a major functional benefit of utilizing a computerized practice management billing system? Option A. Automated reminder dunning messages can be printed directly on statements of overdue accounts. Option B. It completely eliminates the legal necessity of obtaining patient consent. Option C. It allows billing staff to alter procedure codes without provider approval. Option D. It automatically guarantees 100% claim reimbursement by all payers. The correct answer is option A. Automated reminder dunning messages can be printed directly on statements of overdue accounts. Explanation. Computerized billing automates financial aging, claim submission, and standard collection messages tailored to account aging. Question 110. Following an ear irrigation procedure, what instruction or information should the medical assistant give to the patient? Option A. You may experience decreased hearing for several weeks. Option B. You should expect blood-tinged fluid to drain for several days. Option C. You must lie flat on your unaffected side for 24 hours. Option D. Your ear canal may feel slightly sensitive or moist for a short period. The correct answer is option D. Your ear canal may feel slightly sensitive or moist for a short period. Explanation. Patients should be reassured that mild sensitivity or dampness is normal immediately following an ear irrigation. Question 111. Why was diagnostic coding originally developed in healthcare? Option A. To track disease patterns and epidemiological trends. Option B. To evaluate hospital and healthcare service utilization. Option C. To collect standardized clinical data for medical research. Option D. All of the above. The correct answer is option D. All of the above. Explanation. Diagnostic coding was created to classify morbidity and mortality data, assist medical research, track epidemiology, and assess health resource utilization. Question 112. What is the most commonly abused substance among adolescents under 18 years of age? Option A. Alcohol. Option B. Marijuana. Option C. Crack cocaine. Option D. Cocaine. The correct answer is option A. Alcohol. Explanation. Alcohol remains the most prevalent and frequently abused substance among children and teenagers under age 18. Question 113. All of the following diagnostic evaluations are pulmonary function tests except which procedure? Option A. Diffusion capacity measurement. Option B. Pulse oximetry monitoring. Option C. Arterial blood gas studies. Option D. Coronary angiography. The correct answer is option D. Coronary angiography. Explanation. Coronary angiography is an invasive cardiovascular imaging procedure used to visualize coronary artery patency, not a pulmonary function test. Question 114. When the same dose of a drug no longer produces the desired effect, it is said that the patient has developed what condition? Option A. An idiosyncratic reaction. Option B. A drug tolerance. Option C. A drug interaction. Option D. An allergic reaction. The correct answer is option B. A drug tolerance. Explanation. Drug tolerance occurs when a patient requires larger doses of a medication to achieve the same therapeutic effect originally produced by smaller doses. Question 115. Which of the following situations requires the completion of a release of medical information form? Option A. When a patient transfers records to a new physician. Option B. To bill the patient insurance company. Option C. To send the patient records to a consulting physician. Option D. To determine the patient eligibility for insurance benefits. The correct answer is option A. When a patient transfers records to a new physician. Explanation. A release of medical information form signed by the patient is required when transferring medical records to an outside physician or third party. Question 116. What type of clinical document contains a formal written assessment and recommendations provided by a specialist requested by the attending physician? Option A. Consultation report. Option B. Operative report. Option C. Pathology report. Option D. Discharge summary. The correct answer is option A. Consultation report. Explanation. A consultation report provides the expert opinion and management guidance of a consulting specialist back to the primary provider. Question 117. Which of the following letters would most likely be signed by the medical assistant? Option A, order for office supplies. Option B, letter dictated by the physician to a patient. Option C, letter to another physician about a consultation. Option D, medical reports to an insurance company. The correct answer is option A, order for office supplies. Explanation. Medical assistants may independently sign routine administrative correspondence such as supply orders, while clinical letters require the physician's signature. Question 118. When opening the clinic at the beginning of the workday, what is the initial security step the medical assistant should perform? Option A, unlock secure filing cabinets, paper medical records, and medication storage areas. Option B, run end-of-day financial reconciliation reports. Option C, discharge all patients scheduled for morning visits. Option D, turn off all hallway lighting and examination room equipment. The correct answer is option A, unlock secure filing cabinets, paper medical records, and medication storage areas. Explanation. Unlocking files, record storage, and pharmacy cabinets ensures clinical staff have access to necessary supplies and charts for incoming patients. Question 119. How does the procedure for measuring a heart rate in an infant differ from that of an adult? Option A, heart rates are not measured during routine infant examinations. Option B, the apical pulse method with a stethoscope is standard for infants. Option C, infant pulse rates are assessed exclusively using a blood pressure cuff. Option D, the radial artery palpation method is standard for infants. The correct answer is option B, the apical pulse method with a stethoscope is standard for infants. Explanation. Due to rapid heart rates and small peripheral vessels in infants, auscultating the apical pulse with a pediatric stethoscope for a full minute is standard. Question 120. What patient demographic groups are typically treated in a primary care physician practice? Option A, pediatric patients. Option B, adults of working age. Option C, geriatric individuals older than 60 years. Option D, all of the above. The correct answer is option D, all of the above. Explanation. Primary care practices provide comprehensive care across all life stages, including infants, children, adolescents, adults, and the elderly. Question 121. Which of the following physiological consequences may occur when the body fails to maintain adequate tissue oxygenation? Option A, death of cellular tissue. Option B, progressive organ failure. Option C, complete body system failure and death. Option D, all of the above. The correct answer is option D, all of the above. Explanation. Prolonged hypoxia leads to cellular hypoxia, cellular death, progressive multi-organ failure, and systemic death. Question 122. Which of the following statements is true regarding pigmented skin nevi and skin nodules? Option A, they have the potential to undergo malignant transformation. Option B, they should be evaluated by a healthcare provider if changes occur. Option C, they are assessed clinically using the ABCDE melanoma criteria. Option D, all of the above. The correct answer is option D, all of the above. Explanation. Skin lesions should be monitored using the ABCDE guidelines for asymmetry, border, color, diameter, and evolving features. Question 123. In business accounting, which of the following financial events directly increases owner equity? Option A, owner drawing. Option B, business revenue. Option C, operating expenses. Option D, accounts payable increases. The correct answer is option B, business revenue. Explanation. Owner equity increases through business revenues and capital investments, whereas expenses and owner drawings decrease equity. Question 124. Which laboratory microscope feature includes precision control knobs that allow the mechanical movement of the glass slide vertically and horizontally? Option A, mechanical stage microscope. Option B, simple hand magnifier. Option C, fixed stage microscope. Option D, monocular tube lens. The correct answer is option A, mechanical stage microscope. Explanation. A mechanical stage is equipped with caliper knobs to precisely translate the specimen slide along the horizontal and vertical axes. Question 125. Which specific regulatory credential must appear on a prescription when ordering a controlled substance? Option A, physician state driver license number. Option B, physician personal social security number. Option C, physician drug enforcement administration registration number. Option D, physician university graduation certificate number. The correct answer is option C, physician drug enforcement administration registration number. Explanation. Prescriptions for controlled substances legally require the prescriber Federal Drug Enforcement Administration registration number. Question 126. Which of the following statements accurately characterizes nonverbal communication? Option A, it is rarely utilized during clinical interactions. Option B, it uses facial expressions and body language to convey messages. Option C, it is most often transmitted via telephone calls. Option D, it is considered an ineffective form of communication. The correct answer is option B. It uses facial expressions and body language to convey messages. Explanation. Nonverbal communication encompasses body posture, facial expressions, eye contact, and gestures used to transmit unspoken messages. Question 127. Which of the following clinical conditions has the lowest triage urgency and may be scheduled for an available routine appointment in 1 to 2 days? Option A, common cold symptoms with a mild runny nose. Option B, acute crushing substernal chest pain radiating to the jaw. Option C, sudden unilateral facial drooping and slurred speech. Option D, severe active arterial bleeding from a deep laceration. The correct answer is option A, common cold symptoms with a mild runny nose. Explanation. Mild upper respiratory cold symptoms without respiratory distress represent non-emergent, low-priority issues suitable for routine scheduling.